Oh God, I just feel like we're under this ticking time bomb.
All hope for Jori Fales has been crushed.
How can I look my daughter in the eyes and tell her that we failed her? The system failed her.
The EDRD expert committees have not revised their recommendation to discontinue coverage, given that there is no evidence, based on the CDA's clinical criteria, that it would provide further benefits for Charleigh.
Meaning an appeal made by Charleigh's family, as well as professionals in the Batten Disease community 1 week ago to the Minister of Health, have fallen on deaf ears. And Charleigh has now officially been defunded from her Brineura treatments by the province for good.
I'm just so sad that this is part of her story. It's not fair.
The group advocating for Charleigh in Friday's meeting brought forward names of 2 professionals in the field. They say they were not consulted during Charleigh's initial review.
The ministry can confirm that the CDA reviewed and evaluated 8 separate publications by these 2 experts.
I know that the 2 experts, the 2 international experts, didn't receive a phone call this week. They'd been waiting to hear from the ministry.
Andrew McFadden was in that meeting and says that published data the province used is now outdated. He says what the province should have done and was offered to them was to speak to those professionals to find out new, unpublished information on the benefits of Brineura. The province never acted on it.
As a community, this is something we can do for her.
Since Osborne's announcement this morning, another groundswell of support for Charleigh. Today, local pizza on Douglas Street in Victoria is donating half of its profits to Charleigh, which inspired some of its staff to donate their wages as well. Yesterday, this from the West Shore Economic Development Committee.
We raised just under $70,000.
To be put towards 2 infusion treatments for Charleigh. Questions came up that if the drug was purchased privately, would the province allow her medical team to administer the drug? That was answered today by the health minister.
They do have that ability, and it is my understanding that Island Health is in dialogue with the family to enable this to happen, if that's what they decide to do.
I think this was about money, and I don't think they did their due diligence.
The family doesn't know what's next for Charleigh, but Jori fears the worst.
I don't know how we move on from this. Sorry.
Brendan Strain, CTV News, Langford.